We continue our Heart of the Valley focus on diabetes. It's an epidemic in the valley. 1 in 3 people diagnosed with this disease. Here's what you need to know. Diabetes can be managed, it can be prevented, and it all starts with knowing our blood sugar levels. Joining us is Tom Castañeda with South Texas Health System, one of our partners in this effort. Thank you so much for being here.
Thank you for having us.
All right, well, South Texas Health System and our other partner, HEB, offering free screenings all month long. Tell us about them.
Yeah, so at South Texas Health System, McAllen, we'll be doing every Friday from 11 to 1 o'clock, we'll be having those blood glucose checks. So it's that check, it's a simple finger prick that they'll take and they'll read the blood sugar level, and that'll tell you exactly where you stand when it comes to your blood sugar level. And so we will be doing them every Friday at STHS McAllen from 11 to 1, and then HEB also is doing them throughout the month as well.
Yeah, and before we go to get tested, what do we need to know? Do we need to fast?
Well, when it comes to your blood sugar level, they recommend that you do fast, but you can obviously take a reading at any time. But to get a really accurate reading, you should try to go on an empty stomach. You really shouldn't have had some coffee, anything like that. And that way you can figure out exactly where you are in your target levels. But you should be working with your doctor, first of all, to determine what is your target level. But if you have never had diabetes, there is not really a family history of diabetes, then what you need to know is just the normal levels. And that would be anything under 100. So when you do a blood sugar check and you have been fasting, if you're at about 100 or below, you're great. If you are between 100 and 125, that's considered pre-diabetes. So that means you are on the cusp of becoming diabetic. And once you have diabetes, you have it for the rest of your life. So that is your warning. That's the danger zone and your warning sign that you need to take the necessary steps to prevent diabetes.
Okay, so that's from 100 to 125.
And then if you're 125 and over, and this is, they say doctors will want to do a few readings. They don't do it just on the first time, but if you get more than 2 readings, then you really need to talk to your doctor, and that's when they're going to see and do additional testing. There's what's called an A1C test, which is a more thorough blood test where they actually draw blood and they will take a reading, and that reading, they basically take that blood reading and it's over a 3-month course. So your blood finger prick is only just for today. This is what your blood is today, but when they do the draw, it'll tell you what your blood sugar level has been for the last 3 months, and that's when they'll determine if you do in fact have diabetes.
So that's a more accurate reading.
Exactly.
Okay, so this weekend, STHS is getting ready to host a symposium. This is on how to prevent, treat, and beat diabetes.
Yes.
Give us the details. Who should attend? Is it open to everyone?
Yeah, so this is our 3rd annual Prevent, Treat, and Beat Diabetes Symposium. And what we have done for the last 3 years is have this conference for the entire family. It's open to the public, free to attend, along with having some free screenings throughout the day. We have really important presentations. So we have doctor-led presentations that will basically concentrate on diabetes and its impact on our health and what we can do to prevent diabetes or manage and control our diabetes if we are diabetic. So we have different tracks. So we have a seniors track, because when you're older, there are different things that you need to know about when it comes to controlling diabetes. We have an adults and families track, because you need to really understand how you can tackle diabetes as a family. If there's only one person in your family who has diabetes, you don't want to alienate them. So what can we do as a family to address the situation? We have a caregivers track, because in the valley, unfortunately, there are a lot of people who are taking care of their elders, they're taking care of their grandparents and their parents, and so you got to want to make sure that you are doing everything you can to make sure that you're controlling their diabetes and managing it so that they stay healthy. And then we have a miscellaneous track where we'll do some different types of activities, and then we have a Spanish track. So all of the presentation that we have, we also have in Spanish, because there are a lot of people in this community that only speak Spanish, and we want to make sure that everyone gets that important education. But on top of just those doctor-led presentations, we also have exercise and cooking demos. Those are the 2 best things that you can do to prevent any illness, including diabetes, is get plenty of exercise and eat well.
All right, well, thank you so much for joining us tonight and sharing that important information on diabetes awareness. And again, you can check your blood sugar levels for free all month long at HEB locations valley-wide. And with South Texas Health System, we have a calendar with all the dates, times, and locations. Just go to krgv.com and click on the Heart of the Valley button. We'll be right back.